Hi everyone, I'm Jessica Blackburn and this is my submission for the learning activity for this week. So I'm going to start with the integumentary system. Prior to her lumbar puncture, Shayna received an anesthetic injection of lidocaine. Anesthetic. After experiencing third-degree burns on his left arm, Marcus received a skin graft from his own thigh. Marcus received an autograft. Autograft. During her third round of chemotherapy, Tara began to notice herself losing sections of her hair. After her full course of chemo, Tara had alopecia. Alopecia. Megan's 2-year-old son has red, crusty scales on his arm that are very itchy. He is experiencing eczema. Eczema. While getting her nails done, Stephanie requested to have her cuticles trimmed. Cuticle. Okay, now I'm going to move on to the musculoskeletal system. John suffered an untreatable infection from a diabetic ulcer on his left foot, so he underwent a left foot amputation. Amputation. After falling and fracturing her foot, Julie had to see a podiatrist. Podiatrist. While 36 weeks pregnant, Carly's increased weight in her belly caused her to have a sway back or lordosis. Lordosis. Jack was diagnosed with peripheral arterial disease and experienced pain in the calf muscles while walking. Jack was experiencing intermittent claudication. Intermittent claudication. To determine toxicity during a magnesium infusion, the labor delivery nurse tested for deep tendon reflexes. Deep tendon reflexes. Okay, now I'm going to move on to the cardiovascular. To assess the amount of blockage in the coronary artery, James underwent a cardiac catheterization. Catheterization. Following a total hip replacement, Rachel developed a DVT, and the physician prescribed a thrombolytic to dissolve the clot. Thrombolytic. Michaela gave birth to a neonate experiencing mixing of blood in his right and left atria due to a hole in the septum. The neonate was born with a congenital septal defect in the atria. Congenital septal defect. An EMT responded on scene to an overdose patient that was unresponsive and without a pulse. The patient was in cardiac arrest. Cardiac arrest. During a strenuous workout, David experienced severe pain in his chest with a tight feeling around his heart. David's symptom is called angina pectoris. Angina pectoris. Okay, that's all I got. Thank you, and I look forward to reading the rest of your guys' submissions. Thanks.